A healthcare provider strives to promote health, work to prevent disease, and provide treatment through partnership with their patients. Their story is coming up on Polk Place. Welcome to Polk Place. I'm your host, Lauren Lingill. Joining me in studio, we have Ermelinda Centeno, who is with Central Florida Healthcare, and you are also the Polk County Chair for Florida KIDCARE.
Yes.
So, welcome.
Thank you.
We're glad to have you here and learn a little bit more about Florida KIDCARE and see what's going on with Central Florida Healthcare. So.
Well, thank you again for having me.
Absolutely.
And yes, so I am here to represent today Florida KIDCARE and also Central Florida Healthcare. I'm currently the Health Center Administrator for our Haines City location with Central Florida Healthcare. And with the Chair for Polk County, I represent help everyone to understand their choices and options to apply.
Well, that's really good because we were talking before the show started, and I really have a very limited knowledge about Florida KIDCARE. So, first of all, maybe you could tell us what it is and who it's for.
Okay, so Florida KIDCARE is our, what we call the CHIP program for the state of Florida. So it's the Children's Health Insurance Plan. Mm-hmm. Florida KIDCARE is actually made up of 4 different branches, and we have our Medicaid program. We have Florida KIDCARE's MediKids, Healthy Kids, and also CMS.
Okay, I'm gonna have to try this again. So you got CMS, MediKids, and then
Healthy Kids.
Healthy Kids.
And Medicaid.
And Medicaid.
Yep.
Okay. Wow.
And so with the Medicaid program, one may qualify due to the federally poverty level at 133% or below. And also for the MediKids, have to be the ages between 1 and 5 years old. If they qualify, they would be placed into that program due to they would be ranged in the federally poverty level between 133 point, whatever it is that bumps you out of the Medicaid and into.
So that's the really sort of the very impoverished indigent population.
Yeah, well, not necessarily, you know, and sometimes that's what the misconception is. So what is poverty, right, and what are the income limits? So it's interesting right now, we really encourage, and that's why I'm here today. I want everyone to know that if you're a working family, you should apply for Florida KIDCARE. Because right now, for example, for a family of 3, mm-hmm. You can make all of it, you can make up to $45,000. It's about $500, mm-hmm. and if you're a family of 4, you can make up to $50,200. And so,
still be
if
eligible.
you fall within that income bracket, right, you mm-hmm. can possibly qualify.
So
with Florida KIDCARE, there's 2 different payments. So you can either have it free because it's Medicaid, or you have a $15 monthly fee or mm-hmm. a $20 monthly fee.
And that's all based on income?
It's all based on income.
Okay. The program that you were talking about, though, the 1-year-old to 5-year-old, it seemed like 100% of poverty or below at 33% of poverty.
Yeah, no, it's actually 133% of poverty below would qualify you for Medicaid. And then in between that, which would be up to 200% of the poverty level. So depending on your age, would depend on what program you'd be placed in. Okay. And so there's the 1 to 5-year-old would be what they call the MediKids. And then once you turn 5, you would automatically get placed into they would call the Healthy Kids program, and that's all the way up until the age of 18.
Okay, so these different sets within this
mm-hmm.
program are really kind of age-based with a little bit of income consideration.
Exactly, so they just go based on the age, the family composition there, and income, but it is a very affordable plan. All the plans include dental, eye exams, and also, you know, medical services, and there's no deductible, which is another nice thing that people don't know. And so what we've been promoting is that if you're offered job-based health insurance, the family plan unfortunately sometimes is unaffordable or is expensive. And so we're really encouraging for folks to apply. Don't determine your own eligibility and apply, because you never know, you may qualify. And paying $20 a month for the family. So this is the other thing. So if you have 4 children, you pay $20 a month.
I don't know why you wouldn't do that. I mean, if you qualify, I really don't know why you wouldn't do that, because
Right.
you know, this is a pretty elaborate healthcare plan.
Yeah, but it's a good plan, and I think that it's a misconception of when you had mentioned the word poor. And so when we really define what is poor, we have to sort of take a step back.
Sure.
And we don't want to associate the word poor with this plan. And with that being said, we don't want to associate, we just want to know that it's there, it's available, and I encourage everyone to apply.
Absolutely. So let's go back over that again, because there was a lot of things happening. So tell me about the eligibility again.
Okay, so for the eligibility, you have to be a residing resident, lawfully residing resident. At one point, there was a 5-year ban, but no anymore, that is not the case. There is a 5-year ban applying for health insurance for, let's say, Medicaid for adults. But at the moment, if you're a child and you've received your legalization yesterday and you would like to apply today, you may do so. The other thing is that there is the age requirement that we mentioned, so have to be 18 years old. So once they turn 19 years old is when the plan would end.
Okay.
And also just have to be a resident of Florida, the state of Florida, to apply. It is a statewide plan.
Well, I mean, I feel like that's great news. So then parents who are working can really kind of, they don't have to choose between, you know, paying for health insurance or maybe paying for other things that the family needs. That there's a really affordable KIDCARE program that they can pay into and know that their children are going to be taken care of as far as all the medical things that they need.
Exactly. You know, it's an affordable plan. And one of the things for me in Central Florida Healthcare, we provide enabling services. And that's one of the things that we help and we educate people. We have 11 navigators who help have in-person assistance if needed to apply for these services or maintain coverage. And also, that's one of the things that we tell people, you know, sometimes $1 saved here could be $1, you know, then used someplace else. So
Absolutely.
It could be for food, it could be for rent, it could be for so many other things that you have to really look and see what are we paying for health insurance today, and maybe it's an option to qualify. So again, if you haven't applied, then they should apply.
Definitely, and everybody, if not, you know, I realize as adults we make decisions about our health care, but every child, there's not a good reason for them to not have that health care.
Exactly.
Especially with this program. So how do they just call you up and set up an eligibility consultation, or how does that work?
Yep.
Who do they call?
Well, Florida KIDCARE is, first of all, the open enrollment is all year round. So it doesn't matter what time of the year or anything, you can apply anytime. The website you can go on to, if you just probably type in, you know, Florida KIDCARE, it probably pop up, but it is www.floridakidcare.org. And you can go on there. It's a pretty easy application. It is pretty user-friendly. If you want to say it, most people just need the name and date of birth of your child, social security number, and they do ask some type of information, obviously, for the income. And then at one point, once you've done the application, they give you a family number, and you can create an online application. And also, the nice thing about it, once you qualify, and let's say your payments are $20 a month, then you can set up automatic deduction right from your checking, bank account, credit card, whatever you want to pay with, and automatically every month they'll take out that money from your account.
That's nice. That's not, I mean, that's pretty convenient. Okay, so it's just an application process.
It is.
What's usually, I mean, do you know what the turnaround is like?
Most applications, insurance applications, there's sort of that, I want to say, if you apply before the 15th of the month, usually we'll try to get you coverage by the 1st of the following month.
Okay.
When you apply after the 15th of the month, at times you will still get coverage in the next month. It may not be at the first because of the paperwork process being done. But I'm going to say once you apply, I would say anywhere between I would say 3 weeks that you should hear something back, and get everything rolling, and they'll let you know the effective date of that health insurance plan.
Yeah, so you really shouldn't wait until your child needs health care. This is something you should really want to do as soon as you know that, you know, maybe another health care plan is going to run out, or or you're not going to have it anymore, then you really should look into other options right away. So.
Yeah, and I really encourage, especially people who have job-based health insurance and maybe currently have the family plan.
Sure.
So because that usually open enrollment is annually, and there's a certain timeline for that. And so if you're a parent listening today and you would like to maybe try to apply for Florida KidCare, don't wait. I would suggest apply for the health insurance, because this way when you are faced with the decision during your open enrollment, you're able to make a very good choice. You don't want to not enroll your children and you have that 1 month to do so, and then you apply for Florida KidCare and for whatever means you didn't qualify.
Right.
Or if you did qualify, then you're able to make the decision during your open enrollment with good faith that you know you're not going to enroll your children in that insurance plan because they have Florida KidCare.
So thank you for being here, and certainly thank you for sharing with us about KidCare. That's a very important thing. We certainly want to get that message out.
Thank you very much for having me.
Absolutely. Florida KidCare is the state of Florida's high-quality, low-cost health insurance for children. Through its 4 partners, including Florida Healthy Kids, the program covers children from birth through age 18. Monthly premiums depend on your household size and income. Most families qualify for $15 or $20 a month, or for no charge Florida KidCare Medicaid. Non-reduced rates are also available. Florida KidCare will let you know you may have to pay a small charge or copay for some services.